Hey everybody, this is Rob Wilson again with Performance Therapeutics and Prepare to Perform. And if right now you're asking yourself, why is Rob wearing the pants from the old Milli Vanilli video? I'm not. This is actually how white my real leg is. Pretty crazy, right? That's what happens when you're Polish and Irish. So I have my leg out today because I want you guys to actually be able to see some of the tissues that we're talking about. If you don't have an anatomy chart handy, sometimes it's just easier to identify on a person. What we're going to be talking about is the lateral side of the hip. Okay, so just as a beginning reference, I'm going to turn to the side. And most of us have some idea where our quad is and our IT band. And what your IT band actually is an interface between the lateral part of your quad, the lateral part of your hamstrings, right here, right? And that stuff goes up and connects to a couple hip flexors and then to your glutes, right? So you have your glute major, and then you have a bunch of little guys who live underneath all this mess, glute minimus and glute medius. And what we're going to focus on is sort of the upper and side part, right around where your pocket lives. So it's going to get a little sexier here in a second. Our first landmark that we're going to look for is right up here at the top of the hip. So this bone towards the top of your IT band, that's called your trochanter, all right? And that's one sort of primary attachment site for this side hip tissue. So that's our first landmark that we're going to look for. And the second landmark is the top of your hip, or the iliac crest, right? So what we're going to focus on is what goes between this point and this crest. So it's kind of shaped like a little fan, right? There's some different rays of tissue that come out from here. And that's what we're going to focus on. So again, here I'm a supernova. What I'm going to do is put that not on my trochanter, but just above it. I'm going to pull my knee out to the side and let my leg drop off. And then I'm not going to just wiggle back and forth, which is what I see most people do, because that really doesn't do much. What I'm going to do is start to create a wave of pressure. So I'm going to use my body weight to sink in, and I'm going to direct the movement of the tissue by directing the way that my body moves in relation to my tool, right? In this case, the ball. So I'm not really rolling on the ball. I'm using the grid of the ball to actually grab a piece of my butt cheek, right? So even though I'm face up, it's still that same part I just moved over. So I'm really not on the back. That'd be like this. I've sort of torqued my body to the side, all right? So I get in this area. I'm waiting for it to sink in. I feel it starting to burn. I know something's happening, okay? Now once I'm here, I can add some movement. Nice, very prescient timing for a giant truck. So I'm going to add some movement. I just pull my knee in like that, maybe 5 or 6 times, see if that loosens it up a bit, and I can move on to a new spot. What I want to make sure is that I stay in one place long enough to actually change something. So once I clean up from here where that bone is, all the way up to my hip, then I'm going to turn a little bit more to my side and get a different direction. All right, again, I'll spend a couple minutes here. If I find something terrible, I can move my leg and create some motion, and then I can even go all the way lateral. So now basically my tool is right by my pocket. And what I'm trying to do right now is grab hold of this tissue right here and pull it this way, or I can start in front of this sort of glute medius and glute minimus tissue and push it back. All right, either way is acceptable. Whichever way feels the most horrible, do that. All right, so try that out. Hope that works for you guys.